Hi, good afternoon. Uh, my name is Finny. I've been working at the Duncan Hospital at Raxaul in Bihar for the last 5.5 years. I'm an endocrinologist by training, and as a family, we have been here for over 5 years. We are part of this organization called the Emmanuel Hospital Association, which works among the poorer states of India in the northern part of the country. And most of our hospitals are located in remote areas, particularly among the poor, where the poor and the marginalized people are located, and in the tribal belts of north and northeastern India. Looking back over the 5 years, I must say it has been a pleasure to work here. It has been a fulfilling job, caring for people who would not have any good medical facilities in this region. There have been challenges, of course, because you may not have all the resources which you would have in a big city. Yet, to do the best with what is available is a challenge. It forces us to innovate and to provide excellent quality care to the maximum extent possible in this care. And we are supported by many friends who do come from different parts of the country periodically and from overseas to help us, and we really appreciate that. Talking about Raxaul, it is on the India Nepal border, and it is a hospital which is the largest in our network of the EHA set of hospitals. We serve a population of roughly about 11 million in southern Nepal and northern Bihar. We focus a lot on the clinical services in the hospital, particularly in obstetrics and gynecology, pediatrics, general medicine, ophthalmology, and surgical services, particularly general surgery. But the care provided in this hospital does not remain confined to only these four walls. We also strive to provide preventive health facilities in the villages around the hospital in this region. We also have a nursing school where there are about 30 nursing students are trained every year in general nursing and midwifery. We also have a school of laboratory technology where 4 students per year are taken in for a diploma in lab technology course. We have a school attached to the hospital as well, where there's a mission where many of our staff kids and people in this region take part in that particular school, and it's a big blessing for this region. The hospital as such has a fairly brand new inpatient facility for the last 2 years. We have big spacious wards with fairly up-to-date medical equipment in this hospital. We have a well-equipped 10-bed ICU for both adults and children. We have a nice labor room with reasonably good facilities for an obstetrician to work, and there is a well-equipped operation theatre as well. There are 235 beds in this hospital, and more than 6,000 deliveries in a year happen here, and there is a big need for good obstetric services in this region. The hospital really desires that we don't just provide curative services, but that we should go beyond that to impact the communities around us by providing social transformation as well. We also hope that many of them will get holistic care in these regions. We have community programs focusing on patients who have HIV and AIDS. In particular, we have a special project running for IV drug abusers in this region. And we get an opportunity to engage with them and help many of them to make better choices in life and employ harm reduction measures so that they don't contract the deadly viral illnesses like HIV, hepatitis B and C. Our hope is that even the poorest people in this region will be able to access good quality health care which are at very affordable rates. And if there are genuinely poor people, none of them will have a hesitation to walk into this hospital. And so we try to make our costs really low so that the poorest of the poor can access the services in the hospital and in our community programs. We have a literacy program as well, working in the villages. All in all, it is a wonderful place to consider working, because we have an opportunity to really impact the lives of many people in this region which is remote, yet to see many of the smile on their faces and to see God's love being shared with them. I think it's a beautiful place to consider for some of you to maybe come and visit, and who knows, you may stay a bit longer after that.